Justice for all.
Please be seated. Madam Clerk, would you please call the roll?
Supervisor Snyderman,
Here.
Councilwoman Lofstad,
Here.
Councilman Martell,
Here.
Councilman Bouvier,
Here.
and Councilman Schiavone.
Present.
Excellent.
Okay. So let's begin. And we're still on Zoom, though our town board meeting upcoming will be in person. Looking forward to that. And at some point, I don't know that we'll be able to have these meetings via Zoom for work sessions either, but at the moment, it seems to be a good way to let the public participate. So, all right, we're going to start with Ryan Murphy, who's going to give us a brief COVID update. Ryan is our public safety director.
Thank you, Supervisor. Good morning, everyone. So in terms of a COVID update, there are a lot of things that are changing right now. Yesterday was kind of a key date for some increases and mask guidance changes, and those are some of the biggest things that have been going on. The vaccine rollout continues to be successful. Supervisor, you and I were just speaking a few minutes ago, and it sounds like somewhere in the range of 50% to up as high as potentially just short of 70% of the population, depending on age brackets, have either gotten one or both doses of the vaccine. So the percentage that's within Suffolk County, so that percentage is up and continues to go up, although at a much slower pace than it was before, because a lot of the population has already taken advantage of vaccination opportunities. As far as some of the changes that occurred yesterday, as of the 19th, outdoor social gathering limits, non-essential social gathering limits went up to 500 people. Indoor, I believe, is at 250 now at this point for non-essential gatherings, non-residential. Mask mandates were lifted as of yesterday. That's probably the biggest news that's out there. But it's not, none of this, I really need to stress, is very straightforward. There are a lot of little uniquenesses to it. There are a lot of little industry specific things to it. So depending on the nature of the place that you're walking into, or the type of place or the type of activity, those rules change just a little bit. Okay. So vaccinated individuals at this point, as of yesterday, in the state of New York, based on the CDC guidance, no longer need to wear a mask indoors or outdoors when around others. Although there's always that caveat thrown in there. Although if it's a private establishment and they would prefer to have masks worn in their private establishment, they still have the right to have that be a requirement in their private establishment. And you need to, and legally have to respect that right that they've instituted to have masks worn in their establishment. If you are going to be in a crowd with a lot of unknown people in terms of their vaccination status, the CDC guidance, which is what the state is following, still suggests that in large crowds, when there's a high degree of unknown, that masks should still be worn as a protective measure, right? So we can not wear them a whole lot more now than before, but there are still certain settings. There are going to still be businesses and performing arts spaces potentially, or other places like that you may still need to wear a mask, or wear it when you're walking around, but maybe not wear it when seated. Those types of things that may still be instituted, because a lot of places, with the somewhat different interpretations that you can have of the guidance, may be just falling to the lowest common denominator and saying, all right, we're gonna go with masks in here just a little bit longer before we start to pull back on some of that. So we just need everybody to be really patient on it, because although capacity limits have lifted on a lot of businesses, you read the guidance, it's capacity limits have been lifted on most businesses. Well, most isn't all. So there are a lot of different businesses and a lot of different industry sectors that necessarily have capacity limits lifted on them. Things like outdoor amusement areas and things of that nature, they still have specific guidance that they need to follow to the tune of like 30% and so on and so forth. And although the capacity limits may have been lifted someplace, the state guidance and even the CDC guidance still says that we're still supposed to be maintaining social distancing. So you can have 100% capacity and you still need to follow social distancing regulations. Well, in many restaurants, for example, that doesn't work. They don't have enough space to go back to 100% capacity and still maintain 6-foot distancing between tables. So we still have a lot of restaurants in town of Southampton that we are definitely working with them to preserve some of their emergency relief for outdoor dining as a result of COVID, because although they may be allowed to go up to 100%, in order to maintain the social distancing requirements that are still instituted against the industry, they may not actually be able to hit 100% inside their facility. So we're allowing them to use some outdoor space if they have it available to them where it doesn't impede on public walkways and things like that, and increase that number so that they get closer towards what their normal 100% occupancy would have been. So just, there's a lot of uniquenesses to this. We're definitely moving in the right direction. A lot of positive changes here in terms of loosening of the mask mandates, and we have done at Town Hall at this point. We have lifted the mask mandate in Town Hall for fully vaccinated individuals, and that's something that I didn't really stress earlier on, is that the mask mandate liftings are for fully vaccinated individuals. That's somebody that's at least 2 weeks outside of their last shot, whether it's a single shot or a double shot, depending on the vaccine manufacturer that you happen to get. 2 weeks outside of that is fully vaccinated. Or if you're in between shots, you're not fully vaccinated yet. If you got it yesterday, although you may be really excited, you're not fully vaccinated yet. It hasn't had a chance to increase your immunity levels that you fall into that category. So fully vaccinated individuals, for instance, in Town Hall, visitors and employees alike, that are at least 2 weeks outside of their last shot, are able to not wear masks anymore. But we have certainly allocated that if anybody wants to wear a mask, they can do so, even if they're fully vaccinated. A lot of people are quite excited that in the last 12 to 14 or 15 months, they haven't gotten a cold, and they haven't done that in a long time. And they're attributing, a lot of people are attributing that to the fact that there's been this filter over their face and they're not getting normal germs that would have caused them to get, a sinus infection or a cold or this or that they would have had every other year in or around, February or March or whatever. So there are a lot of people out there that are saying, I know the mask lift has happened, but I still want to wear mine around a little bit longer. And in public transportation, on buses, trains, planes, there's still a mask order in place for a lot of those types of activities too. So good changes, but be sure that you don't judge anyone or get frustrated or angry with anyone, because there are a lot of different special guidance areas that apply to different types of businesses. And there are a lot of different understandings right now. We're coming out of this this pandemic. Hopefully we can say that right now. We're coming out of this. And remember the confusion going into it with the guidance changes. We have a lot of the same types of confusion coming out of it. And so we just need everybody to be really patient. And if you're not sure, then err on the side of caution and just, throw the mask on for a little bit longer. You've been wearing it for 14 or 15 months now anyway. So another couple of days or whatever, or, 2 minutes to go through this area, because I'm just not sure. And I see a lot of people, and I think maybe it's the right thing to do. Those are decisions that we should be making just to err on the side of safety. And then, take it off when we're in a more comfortable place. So those are the changes right now. And there's a lot of little special individual changes that it would take us a long time to go through, but I would refer people back to the New York Forward website as well for additional information. If you're not sure about your specific industry or your specific type of activity, it's forward.ny.gov. And you can see whatever the most current guidance from the state of New York is with regards to specific businesses and industries.
All right. Any questions for Ryan?
Ryan, I want to clarify something. So restaurants can open up to 100% of their capacity based on the new Suffolk County Health Department. But they still have to maintain 6-foot social distancing between parties or groups.
So, to be honest with you, Councilman, I'm still seeing on the New York Forward website what appears to be like 75% numbers on there. So I'm looking for a little more clarity on it. But yes, I can definitively say that the guidance does still say that social distancing must be maintained. So even if we're at 100, most places I can guarantee you will not be able to achieve 100 while still maintaining social distancing. They might be able to get 75 or 80%, which is I think where we're technically supposed to be at. I don't know that the business capacity rules for restaurants have gone up to 100% at this point. I think they still are one of the areas that have some specific industry guidance that keeps them at around that 75% point. But realistically, I don't know that they'd be able to achieve 100% anyway and get much over 75% while still maintaining the social distancing amongst parties.
Okay. We're getting questions on that. You know, of course, the restaurants with the warmer weather and the season coming, they want to be up and running as,
Sure.
as much as they can. Okay.
Yep.
Thank you.
And I'm gonna clarify that whether we're at 75, whether we're at 100 for indoor capacity, just to be certain. But again, it's probably almost a bit of a moot point whether we're at 75 or 100, as long as the requirement is still there for the social distancing, because it probably won't let people get past that 75 or 80% anyway. Not a lot of restaurants had a lot of open space just laying around that wasn't being used in their facilities that they could expand out into.
Right. They do like the out. Georgia.
Yes.
So.
Okay. Other questions for Ryan? In terms of our vaccination rates, and I haven't seen the numbers. I'm hearing that the East End is leading the county in terms of the percentage of their population vaccinated, which is good. I haven't seen that, but I did get a call from Newsday about that. But I am looking at our Western Suffolk versus Eastern Suffolk in terms of positivity. And, you know, we are getting, we're still getting cases in Southampton. You know, some days it's been down as low as 1. Some days it's been as high as 3 new cases over the last week or so. I looked at the past 9-day period. We averaged about under 2 cases a day. Over a 3-week period, it was about 3.5 cases. And over the past week, it was about 1.5 cases a day. So we're getting there. The East End has been pretty good. Over the last week, the 5 East End towns have had an average of just under 5 cases a day throughout the entire East End. That compares to 110 cases in Western Suffolk. So normally, you know, we're 1/10 of the population, we would have 10%. So if they had 110, I would expect our number to be around 11. You know, our number's half that. So we are seeing the East End sort of leading the way in terms of recovery. In terms of what percentage of our population, it's hard to say whether, you know, we've hit that 60% target. We're certainly on our way to it. It depends if you count those under 16. But for those over 16, we're probably at 50% with at least 1 dose, and no, probably 50% with 2 doses, and probably at least 60%, or probably closer to 70% now who've had at least 1 dose. So within the next couple weeks, that population over 16 will probably be close to 70% of that population will have been vaccinated. And you know, I attribute that to a number of factors. Certainly having the state site at Stony Brook, Southampton has been really helpful. And then of course, the Greek Orthodox Church and St. Rosalie's and the other, you know, independent vaccination sites, including some of the pharmacies now. in our transportation programs and our public education programs. And I think a general attitude on the East End that has been favorable to getting vaccinated has helped contribute to the higher rates of vaccination on the East End than elsewhere. So that's all good news. All right, anything else for Ryan?
Yeah, I have a quick question, kind of to your point, Jay. So we're somewhere, I think we had said 50 and 70% vaccinated. Do we have any idea when that herd immunity comes in, which would include people who had COVID, who may be just immune to it, you know, from the big get-go?
So, so herd immunity, the numbers that people have typically, I have heard from the scientists referring to, has been somewhere around that 75 or 80%, you know, vaccination rate. And we're actually getting pretty darn close to that 70% point right now. As the supervisor just said, we are somewhere, I think, for 16 over population, we're somewhere right around between 50 and 60%. That probably more on the side of the 50% or so for fully vaccinated, with a slightly higher number than that, a slightly higher percentage that have had at least one dose when we factor the single, you know, the half vaccinated individuals into the mix on that. So we're creeping up towards that 70% mark. Now, herd immunity, when people talk about it when in the sense of vaccinations, again, you're typically talking somewhere around that like 75 to 80% mark. And with vaccine hesitancy, with, you know, not everybody necessarily wanting to get the vaccine, we may not necessarily hit 75 or 80% vaccination rate. As of probably about a month ago, the number of vaccinated individuals in the United States exceeded the highest year of vaccination rate ever for influenza vaccines. If we use that as a barometer to say, you know, how many people can we expect might get this vaccine based on how many people typically go out and get a flu vaccine, we're in good shape, because we, you know, the highest year ever for flu was like 125 million people. And as of that point, we were at like 160 million people with the COVID-19 vaccine. That sense of urgency, the need and the intelligence to go out and grab this vaccine if you're capable, is there. People want to do it. So we do see more people getting it than typically get the flu vaccine, but we're starting to slow down with those numbers. That said, when you add the vaccinated individual count in with people that have had pre-exposure to COVID and may have some sort of natural level of immunity within their system already, or were treated for COVID and got an infusion and have a natural level of immunity within their system from the infusion, if we can get that number of vaccinated individuals as close as possible towards that 70% mark, adding to that the number of people that have some sort of natural immunity in the system, I think we're in really good shape to start to really kind of feel like we can say there's a level of herd immunity within the population, because we have so many people out there that then act as a blocker in the transmission of the virus. They stop the spread. You know, if you're standing there, all it needs is that one domino to be pulled out of the line so that it doesn't keep going down the chain. And that's what these vaccinated individuals, or these individuals that have a level of immunity that they maybe aren't going to get reinfected, they act as those blockers that just stop that chain of transmission from proceeding on down the line. So I think we're in really good shape. I don't know that we're going to be able to say that we achieved herd immunity through just vaccination alone if we're going to hit those numbers. But when we add the vaccination numbers and the people out there that have some sort of a level of immunity from being infected and recovering from it, or being treated and for COVID and having the infusion, et cetera, I think we actually are going to achieve what the goal was anyway, hopefully, very soon.
Okay, thank you.
All right, any other questions? All right, then let's move on in our agenda. Thank you so much, Ryan, as always. And I guess we'll take a moment out to review the draft agenda. And then we have the addiction and recovery thing. So just give me one moment to get the draft agenda.
You also have 2 add-ons, Supervisor.
Okay. So this is for the May 25th meeting. And that meeting will be held, as I said, at Town Hall. It's going to be at 6 p.m. And Charlie, it sounds like you've made some provisions for the public to actually be able to speak via Zoom. Is that correct?
Yeah, I'm still working it out, but I think I'll be able to do it.
Okay, that'll be an interesting hybrid meeting. It'll be nice to see everyone. Again, anyone who is not fully vaccinated does need to wear a mask, or anyone who you certainly have the option to wear a mask, even if you are vaccinated, if you have other concerns. So we welcome mask wearing, but it will not be mandatory. So let's see, we're going to have a number of public hearings. Oh, actually only 2. We have the first one is on acquiring development rights of lands of Photonic Land Trust as contract vendee Shinnecock Hills, and amends the Community Preservation Project Plan and the CPF Management Plan and Stewardship Plan to include that property. I am expecting a lot of participation on this one. At least this is what I'm hearing. There might even be a rally in support of the town board's acquisition of this. This is land in Shinnecock Hills that contains a burial pit and the most, to the Shinnecock Nation, the most sacred of their burial areas. So that is something that they certainly are going to be advocating strongly for, the preservation of that property and the restoration of that property. The second one is a public hearing to amend Town Code Chapter 111, entitled Beaches, Parks, and Waterways in connection with parking permit requirements at Foster Memorial Beach, Westcott Cameron Beach, and Sagmain and Mecox Beach. So that is, I think Foster Memorial Beach, that's the one up, that's Long Beach. So this is,
Yes.
I guess this is basically related to the arrangement we have with the Village of Sag Harbor. Go ahead, Tommy John.
Yeah, I was gonna say, this is the agreement that we made with the Village of Sag Memorial Beach and its access.
Right. That
It
will,
requires a code change.
okay. So that basically
Requires a public hearing.
anyone with a Long Beach sticker will be able to also park at those other beaches, Scott Cameron, Sagmain, and Mecox. And the village, in exchange for that, is paying the town $10,000. So the only people who can buy the Long Beach, though, you have to be a village resident to buy that Long Beach only sticker. And now it will allow other beaches as well. Any questions on that? All right, then let's move on to our resolutions. And yeah, John is correct. There's a couple additional ones, but let's get through these first. So 36573, authorized purchase of ammunition from New York State OGS contract with Eagle Point Gun, TJ Morris and Sons. 36620, authorized purchase of motorcycles, police from Harley Davidson of Suffolk. 36600, authorizes the supervisor to enter into an agreement with Saunders Broadcasting Corporation to provide public Wi-Fi at certain town beach facilities. 36546, authorized supervisor to sign a satisfaction of mortgage on a community development block grant. Oh, that's John. That's your resolution. Go ahead. I'm sorry.
No problem. You did it already. 36546, authorize the supervisor to sign a satisfaction of mortgage on a community development block grant loan. It's also co-sponsored with Councilman Schiavone.
And 36623, authorizes the supervisor to sign extension with J. Cole Construction Company for Town Hall accessibility new elevator.
36622, award and authorize supervisor to sign contract for Shinnecock Commercial Fishing Dock with Brandt Marine Incorporated.
36-571 recalls and amend Town Board Resolution 2021-246. Has to do with towing rates and storage rates for vehicles. 36521, resolution authorizing the supervisor to enter into an intermunicipal agreement with the Village of Sag Harbor for the payment of a fee by said village to permit Sag Harbor Village residents within the boundaries of the town of East Hampton to pay resident fees for the use, I think there should be the word of, certain town of Southampton beaches.
Town Board Resolution ID 36621, award and authorize the supervisor to sign a contract for Hampton Bays Transfer Station booth replacement with MRJ Industries Limited.
Sunday, if we could go back a moment on 36521, I'd like to be added as a co-sponsor. Thank you.
Certainly.
Okay.
Will do.
Town Board, Town Board Resolution ID 36619, co-sponsored with Councilman Schiavone, is the 2021 demolition of 503 Noyak Road, North Sea.
36279, authorize adoption of the 2021 CPF pilot plan and payment of the 2021 pilots. 36604, deposits monies into escrow account for professional services in connection with a groundwater monitoring plan review for Lewis Road Plan Residential Development. 36562, establish restricted account for citizen science projects. 36624, Hampton Bays Volunteer Ambulance Service Award Program.
Town Board Resolution ID 36575 is to reappoint members to the Conservation Board. Town Board Resolution ID 36577 to appoint George Hine, Vice Chair of the Conservation Board for 2021. Town Board Resolution ID 36579, appoint Thomas Florio to the Conservation Board.
Okay, 36566, authorize additional funds for O'Brien and O'Brien LLP as it relates to the matter of Thomas J. Salvatore versus Deborah Renee Brathwaite and Gary J. Weber. 36602, resolution to authorize the settlement of the litigation matter Donald F. Woods Jr. versus the town of Southampton. 36533, resolution to adopt amendment to Town Code Chapter 111, beaches, parks, and waterways in connection with parking permit requirements at Foster Memorial Beach, Scott Cameron Beach, Sag Main Beach, and Mecox Beach. So that's related to the public hearing. That will be
Town Board Resolution 36570, authorization of cost reimbursement waiver for Hampton Bays High School class of 2021 commencement parade held on June 21st, 2021 from 6 to 7 p.m.
Town Board Resolution ID 36568, co-sponsored with Councilman Schiavone, the memorializing resolution in support of Assembly Bill A 2633 and Senate Bill 6492, which enacts the Photonic Bay Regional Community Housing Act.
36572, memorializing resolution in support of Assembly Bill A6667 and Senate Bill S5984, authorizing the town of Southampton to enact a homestead exemption and cap on assessment increases for real property tax purposes.
May I be a co-sponsor on that?
Absolutely.
Same here, Sunday, please.
Okay. Got
So
it.
if you guys are familiar, that is that mechanism that we're trying to get in place to protect people when the value of their property goes up suddenly without them doing anything, just simply because that area got very popular. This is to buffer so that their taxes can't go up. It also lowers all year-round people, anyone with a year-round residents who, you know, in the STAR program, basically an immediate $50,000 reduction in your value for taxation purposes. So when we apply the tax rate, it's against not the full value, but a number $50,000 less than that, which if you have a $500,000 valued home, that's 10% reduction. So that's a pretty nice reduction in taxes. So yeah, we're asking for both those things, a 5% cap on how much your assessment can go up based on market conditions, and that homestead exemption.
And are we doing, Sunday, I'd like to be added as a co-sponsor as well. Thank you. And are we going to be doing something like this for the 5% increase per year?
Yeah, that is included. Those bills have both those pieces in it, I believe. Yeah, so yeah, it has both. So it has the 5%. If you read one of the resolves, it says enact a homestead exemption reducing the assessed value of all year-round homes for taxation purposes in the amount not to exceed 50,000, and cap the amount of value of a property may increase for tax purposes due solely to market trend adjustments at 5% in a given year.
Thank you.
So yeah, they're both there. All right, so 36548.
I'd like also to be added to that. I think the board has discussed this quite a lot. So I think we're all in agreement about this.
Yeah, and we had a committee that worked really hard for months to put this plan together and study the heck out of our assessment system, which has some really good aspects to being a full value town. But it also has some preventable problems if we get this legislation. So, this could really help us, I think, if the state is able to pass it. So yeah, thank you all for your support on that. All right, so 36548 accepts retirement of Adlin Ofant, Associate Administrator in CPF. That's a little bittersweet because we love Adlin and she does such a great job, but we certainly wish her the best in retirement. 36320 accepts retirement of Don Bambrick, Animal Shelter Supervisor and Public Safety. Wow. Don's been with the town as long as I can remember. Does a great job over there in animal control. And I guess he's going to be separating from employment and retiring. So that's great for Don, but a big loss for the town. 36549 accepts a resignation of an administrative assistant in land management. 36550 appoints Elizabeth Cohn to legislative aid in the trustees office. 36551 appoints Allison Spano to administrative assistant position in public safety. 36536 creates custodial worker 2 position in municipal works and appoints Robert Colson to that position. 36569 appoints Craig Carroll to custodial worker 1 position in municipal works. John, you're next.
Town Board Resolution ID 36535, a notice of public hearing to accept a grant of conservation easement from Joseph F. Gaza for property to be maintained as open space located in Quiog pursuant to Southampton Town Code 244-4, obtaining a development rights certificate, and Chapter 247 General Municipal Law of the State of New York. I'm going to withdraw or pull Town Board Resolution ID 36559.
Okay.
Town Board Resolution ID 36565, road review application for Anthony Mezzatesta, Suffolk County tax map as indicated on the resolution, situated at North Sea, is accepted. Town Board Resolution ID 36563, road review application for Michael Mezzatesta, Suffolk County tax map as indicated, situated North Sea, is accepted. Town Board Resolution ID 36558, road review applications for Soji 51 Arbutus Road LLC, Suffolk County tax map indicated on the resolution at Shinnecock Hills is accepted.
3442 is assumes lead agency for the purpose of secret in connection with a change of zone application entitled Concern for Independent Living that requests a change from R20 to multifamily MF44 and an increase in residential density pursuant to 330-8 to enable 12 units per acre in order to construct a 60-unit supported housing development that is 100% affordable in the hamlet of Southampton. And then we had some add-ons. Give me a moment here. Okay, we had 36214 authorizes the acquisition of lands of the estate of Peter Balkheimer in Hampton Bays and amends the CPF management and stewardship plan to include that property. We've held the hearing on that. 36295 authorizes acquisition of lands of Shinkonic Corporation, Shinnecock Hills, and amends the CPF management and stewardship plan to include that property. We also held a public hearing on that. Okay, are there any other add-ons? I guess that's it. All right, anybody have any questions or concerns about the agenda? So, all right, so Sunday, you're good to publish that.
Thank you.
All right, we are about 10 minutes behind schedule, not too bad. So we're going to move on to Addiction and Recovery Committee report on behavioral health services in the town. And we're going to be joined by Nancy Lynett, our Youth Services Director, Mark Epley from Seafield, our Police Chief, Stephen Skrzynecki, Kim Laube from HUGS, and Connie Conway, who's been a part of the committee, also works for the town in Sun TV. So, all right, who's going to introduce this?
That would be me. Good
All right,
morning,
then.
Mr. Supervisor and members of the town board. Thanks very much for taking the time to meet with us today. Coincidentally, this is Mental Health Awareness Week or Mental Health Week, and today is Mental Health Action Day. So it's a good day to be discussing these issues with you. Joining in the conversation, like you said, are Mark Epley and myself, who are co-chairs of the committee. Unfortunately, Chief Skrzynecki has had a commitment this morning. He was hoping that he was going to be able to do both, but the timing didn't work out for him. So we'll be sharing some comments from him. And we also have on the line Paul Garson, who works at Southampton Hospital. He's a local psychiatrist. And Brian Zahn and some of the staff from Southampton High School. They're all part of the committee and had some things to share on the topic too. We asked to meet with you today because we wanted to talk about the current status of comprehensive behavioral health care services here in the township. In short, this community is severely underserved on both fronts. Somebody described it as we are undertreated, inappropriately treated, and often not treated at all as a community. So there are several factors involved here. There's many, we'll be going into some of them later, but they include clinics struggling to keep their doors open for a variety of reasons, including financial, a patchwork system of private providers that may or may not accept insurance patients or take certain kinds of clients, a population, some of whom are underinsured or lack insurance, poor reimbursement rates that are set by the state and by insurance companies, transportation issues and difficulties, and there's more. But not least, another hugely important, significant factor in the problem really is stigma, reluctance to accept care or even seek services because of stigma. So there has been increased attention to this in recent years by the town. The town has certainly been stepping up its efforts to work to provide these services. The county has recently really been putting some more money into substance use disorder deliveries. The state has also stepped up, particularly in the area of children's mental health. But unfortunately, although there's been a little bit of improvement in certain areas, we haven't seen a real improvement in township residents who are in need of services being able to get them. So in fact, among youth, we see escalating mental health indicators. More young people are reporting symptoms of depression. The kids that we see for counseling services have more critical issues than they did before in terms of self-injury and suicidal ideation, where there are many indicators that the pandemic has significantly exacerbated the incidence of substance use disorders, need for treatment, relapse of those in recovery. And there's also been well-documented levels of increased stress, anxiety, and depression and related concerns among all age groups as a result of the pandemic. And the prediction of most experts is that the aftermath of this pandemic is going to be continuing. We're going to be facing a continuing challenge. So in the meantime, the presence of actual services in our community has actually declined over the last couple of years. Family Service League closed their last clinic located in the township last fall. Town residents can now travel to Riverhead, East Hampton, or Mastic, or use Family Service League's telehealth services. They do remain our primary mental health clinic provider. They see almost 400 residents on an outpatient basis, largely virtual over the last year, although they are beginning to see some folks in person. But this type of arrangement does not work for everyone. In fact, not for many. In terms of substance use disorder treatment, one of only 2 outpatient clinics located in the township closed a couple of years ago. We now have a part-time clinic at that site, and we have one other clinic that's open full-time that sees about 100 clients at a time. Specialized treatment is very spotty locally and often requires travel to access, whether it be for mental health treatment or substance use disorder treatment. So the Addiction and Recovery Committee feels like we're looking at an uphill battle. Our service system is backsliding, and the resources we have are insufficient. And the way that the committee is set up, we're a group of people who have many responsibilities, and nobody really has the time to dedicate to this that we would like to see happen. So still, we do have some ideas that we want to share with you today. So that's really why we're here, not just to talk about how bad it is, but maybe we can start looking at some ways that we can respond. I'm going to start out by outlining what the town is currently doing, which we're really grateful for. Obviously, the town has formed the Addiction and Recovery Committee as a formal town committee. 3 town staff members are currently involved, myself, Connie Conway. Connie really acts as our, she's the one that really convenes our meetings and, keeps us moving and handles any communications. Our efforts largely have centered around awareness activities and community education. The Mental Health Awareness Committee has been functioning for a few years. They were sort of an offshoot of Disability Advisory. they have been more of an informal community, not formally appointed, and two town staff members, myself and Jamie Bowden, work with that group. The Youth Bureau, obviously, we provide direct short-term counseling to youth and families. We are active participants in several community coalitions that address substance use prevention. And of course, prevention and wellness activities are incorporated into most of our program offerings. This is obviously one of our main thrusts. So, and we have always appreciated the town board's support of our work in that area. We also, through the Youth Bureau, contract with Family Service League to provide clinical services. And that includes the town's contribution to the South Fork Behavioral Task Force. This funding has primarily supported emergency psychiatric services for youth. And that has actually been pretty effective, preventing costly trips to CPAP and providing a more immediate and responsive service to youth in crisis. The other Youth Bureau contract that is relevant that the town supports is for HUGS, supporting their prevention services townwide. And through the Human Services grant that Jamie Bowden handles, the town does give a small grant to Catholic Charities. They're the ones who manage the one full-time substance use disorder treatment clinic in the township. And also Riverhead CAP, who offers prevention services for those in the Landers, Riverside, Northampton area. So, so we have others on the committee that are going to talk to you now more about what the need and sort of what their perspective is related to their different areas of work. I know Chief Skrinecki, I spoke with him this morning. He asked me to pass on that the police department certainly is concerned. I did send you an email that with a report that he had provided showing actually an unfortunate uptick in opioid deaths in 2020. And he reports that 2021 is on track to outpace 2020 in terms of opioid overdose deaths. He is also, I'm sure you know that he's involved with police chiefs from across the country and actually across the world. And he is also hearing a lot of concern about the effects of the pandemic and the impact of that on substance use across the United States. And he, is concerned about the ability to meet that need. He also, when the substance use clinic in Southampton closed, they were acting as a referral source for the police department to refer cases when they saw individuals who had overdosed or who were experiencing significant drug issues. So that referral source has now been lost to them as well. So that's would be his other concern. He did ask me to tell you that he'd be happy to talk with you some more at another time. So now I'm going to throw it over to Mark Epley, who's going to share with you, his what he sees from the treatment perspective, and also he just knows a lot about everything.
Well, thanks, Nancy. My wife would disagree with you on that part. So, looking at the current situation with substance abuse, I know we had the vigil, which was very well attended, and in reference to the opioid overdose deaths and stuff, and remembering that. But like I said there, I think that a couple of things that we don't want to lose perspective on is that 11% of the population battles substance abuse issues, and there's a mental health component to it also, especially with the co-occurring disease where people are self-medicating. In the last year, we've watched alcohol sales go up about 350%. A lot of people are isolating at home. Now it's starting to open up a little bit, and all of that rolls over. Last year, from my perspective, in an outpatient setting, we were Sorry, we were, we were off about 15% in our outpatient numbers and around 10% this year as things have started to open up. From an inpatient standpoint, we are looking at a waiting list right now. It's something that we haven't seen in a long time. So I anticipate the impact of COVID and the substance abuse field, some things we felt for decades around here, across the world, actually. So, currently in the town of Southampton, Nancy touched on a lot of this stuff, but, we really only have from an outpatient standpoint, a part-time clinic in the village of Southampton, which is run by Stony Brook and Eastern Long Island, and they have a great program and a lot of resources and stuff. It's just not a lot of availability, especially as the state starts to open up all the OASIS treatment programs. They're starting to have people come back into programs. They're limiting group sizes. So issues we're going to run into are, the transportation, getting people to and from, and the availability of treatment. So those are some issues that we are running into, especially out on the east end of Long Island, where the resources are fairly limited and stuff. So I'm going to leave it at that. Well, I will also say that you guys have to make a decision in reference to the marijuana legislation. And it is a gateway drug. And it's probably about 80% of the people that we see that come into treatment that actually recognize marijuana as one of the very first drugs that they use, and it's onset at a very early age. And you have a challenge in front of you. I just want you to take into consideration that the impact of this and where you're going to allow places to open up and stuff. So, and the moment you make that decision, you can't go back on it and look see studies later on. So, I really want you to think about what's facing you guys and the impact. So, and I say that because I'm a guy who fell out of college because he enjoyed smoking a lot of pot and drinking a lot of alcohol. So, I ended up in the Navy. So, it's
still turned out okay, Mark.
a lot of work. Yeah, a lot of work. So I appreciate that. But it's but I see it, people coming into treatment and stuff. So I'm gonna turn this over to Kim Lowby, who's going to talk about gaps in prevention perspective. So, Kim.
Hey, everybody. Thanks, Mr. Supervisor, and everybody for your time today. Certainly want to touch on the continuum of care, right? Oftentimes when we think about prevention or think about treatment, we think about them as these opposite ends. And I think we can really do a great job in kind of bridging the disconnect. Oftentimes, when folks call us to try and find help, it's about 6 months too late. And one of the reasons why it's 6 months too late, whether it's a family calling or whether it's somebody coming, an individual coming through the door, it has so much to do with the stigma around it. Now, stigma alone is not the only reason. We can break through all the stigma barriers and we're still going to have an access to affordable care on the East End. I can't tell you how many countless times I've had families come where their kid is kind of in crisis. Now, again, we're prevention, so we're very far upstream, but parents will oftentimes call us and say the kid's showing some signs that I'm a little concerned about. Maybe I found some alcohol, maybe they came home drunk, maybe they're smoking some pot. There's this in-between spot that could be so brilliant in this space of being able to help get young people re-engaged in positive outlets in the community. And but that takes some extra hand-holding to do that. And so by supporting the opportunity to close that gap, to reduce stigma and to provide opportunities where folks know where the resources are, know that yes, throughout COVID, we've accepted this idea it's okay to not be okay. That works very well in some ways with mental health. Addiction, there's still tremendous structural societal, and self-stigma that happens. And so our job, this kind of Herculean task, is to look at this all comprehensively. And it's hard from a policymaker point of view, or even from an agency point of view, to look at this thing comprehensively, because oftentimes there's not enough money. But we need to begin to come together and figure out ways that we can realign our arrows so that we're pointing towards a healthier Southampton, right? And if you take, I think it was the front page 2 weeks ago from, I want to call it the Chronicle, but the press, if you take a look at it, on one corner, it had great coverage of our vigil and how we honored those who died. And then in the upper corner, it's talking about marijuana. Somewhere we need to create some consistency in pointing our arrows to creating healthier families, healthier schools, and healthier communities. This is not just a job for the schools to fix. This is not just a job for families to fix. It's about changing community, environment, and social norms. And so the opportunity to begin to talk comprehensively, to not just throw things that stick at the wall and hope that they work, but to really move through a very strategic process in getting us to help folks get the help they need, access care when they need it, not wait or not hope that the family can afford either the co-payment, or in Southampton, we have so many private practices. Oftentimes families can't afford the private practices. And so our charge becomes, let's take a look at how do we reduce stigma? How do we build some supports in that kind of 6-month window? How do we help folks on the far end of the continuum of care so that we can get them access to information and stuff quicker, and how we can work together more effectively. But the call is there. We must up our game. We certainly have some opportunities to start this community awareness level within August 31st. You have opiate overdose, overdose awareness day, which kicks off September 1 into a month long of recovery month awareness. And that also gets marked with prevention awareness as well. This group can get involved in supporting initiatives as simple as lighting up the windmill like we did last year with purple lights, wearing your the lapel pins that we offered you. And it's little things like that which help lead to bigger things, which help create an environment that is healthier for all. So let's get more folks in prevention. Let's stop looking at prevention as the school's job to do. It's all of our jobs to do. And let's work together to help break some stigma. Am I supposed to introduce somebody next? I forgot. Who am I introducing? Mark or Nancy? Somebody help me out.
Okay, I think maybe Dr. Garson would go next, but before he goes, I would be remiss. I know the chief is probably saying, she didn't mention everything I said about marijuana when we talked this morning. He does have a lot of concerns about the impact of marijuana legalization in the township. I know he plans to, or he hopes to meet with you soon to talk more in depth about what his concerns are. But he feels as though it's definitely going to affect the work of his department in terms of enforcing or helping people with substance use problems. So Dr. Garson, do you want to please step up next?
Well, thank you for having me today, and thank you for the board for listening. I guess one of the problems about coming after this 3 excellent presenters is I don't have any more of a little piece of papers that have to be presented because you guys did such a wonderful job. However, the question that I started off wondering about is the fact that we all see these little programs, and we have lots of various community programs that started it. But the reality is there's not one specific program that has the authority or the responsibility to coordinate this care, to take the ball and say, this is something we're going to do. It requires much more work than any individual one. And unfortunately, the work is not synergistic where the Committee on Substance Abuse works with the Committee on Education and Committee on Prevention, and they pull it together. Unless there's a coordinating service that will do it, and that's what I'm hoping the town board will look into. With regard to marijuana, one of the factors with regard to marijuana that should be noted is that marijuana is a gateway to smoking, to tobacco, as well as all the other aspects that we feel is a problem. And we have enough problem with just dealing with mental health services, let alone the fact that we're going to be introducing a medical issue as well. With regard to treatment, I've been a director of psychiatry, mental health services for 15 years at Stony Brook Southampton Hospital. And we get all kinds of calls, just like Kim gets all kinds of calls, people who are desperate. And there's no coordinated service of how we could, number one, assess what they need and then get them to that service. The loss of the clinic in West Hampton Beach is very hard on us. We have now one little mental health clinic all the way in East Hampton, that's always full. Meeting House Lane has a small mental health service which is coordinated within Meeting House Lane itself, and we're always full as well. So how do we get this patient? The vast majority of patients that we know who have illnesses are depressed or anxious. And there's only 1 out of every 10 that will get treatment. 9 out of 10 sometimes don't even realize they have a treatable illness that could be available even if they wanted to. So education is an important part of that leg of that stool that we need. So we need access, we need education, and then we certainly need the services in an affordable manner. And that's all I have now because everyone else did such a great job.
Thanks very much, Paul.
Thank you.
Brian Zahn, who's the principal of Southampton High School, is also part of the committee. So he's here to offer, and I think Kim McLean from his from the social work staff are here and can talk a little bit about what schools are seeing.
Thank you, Nancy. Appreciate that. Yes, I'm joined by my 2 social workers who are in the trenches on this very topic and in the field here. They are Kim McLean and Arlette Flores. So welcome to Kim and Arlette. And they're going to share a little bit beyond what we are experiencing. But I think what you're going to hear from us in the field is the themes that you've just heard from everyone presenting are certainly the themes that we're going to be bringing you here, because we are seeing an increased demand in the mental health needs and addiction and support, the support needed for substance abuse and addiction here for our young people as well. And there are significant challenges of being able to provide those supports on the East End. So I am going to turn it over to my specialists here. And just so you know, we have gone and had to hire additional staff in the area of mental health needs and substance abuse counseling just to try and meet or come close to meeting the demands that we are facing here in schools. So that's an important piece that schools are faced with, really trying to increase the amount of staffing needed to come close to addressing some of the challenges. And certainly we've done that here, and we're very fortunate to have now 2 full-time social workers, 5 counselors. We have a psychologist, and we also have 5 counselors on top of that. So we're hiring a boatload of staff to try and meet those needs, and it's still not enough. But let me turn that over to Kim and Arlette, who will speak to you about what we're experiencing and some of the struggles of meeting those needs here on the East End.
Thank you, Dr. Zahn. Good morning, everybody. My name is Kim McLean. I am the social worker here. I'm also the prevention specialist in the building, which I know, Ms. Labby, you and I will be talking a lot in the next couple of weeks, hopefully, to bring some more prevention into this building. I've been talking to Jackie a lot. So I think one of the main issues that we're seeing is not only are our marijuana, the marijuana use in our students is increasing, but the age is also going down. So I know in a lot of cases with treatment, the age that we have the ability to get treatment for is higher than the age that they're starting to use. So as Mr. Epley said before, it is a gateway drug, and we're seeing kids as young as 8th grade, unfortunately, in a lot of our local schools. And one of our
Yep, and just to piggyback on that, and because speaking on behalf of some of the East End schools, we're dealing with that in some cases as early as students in 6th and 7th grade now. Go ahead, Kim.
And another one of our major issues is transportation to Riverhead for the assessment process and treatment for some of our kids. A lot of our students come out of school, their parents are working, they can't get them there. So that, you know, the lack of treatment in the village and in our area is really causing issues for that. Also, the DASH program is wonderful, and if we could get something in that capacity out here, it would be very helpful. We have crisis intervention often, and they have to go to Hauppauge sometimes if they can't get right into into East Hampton, I'm sorry. So a lot of it is just the lack of services in the town itself and the way to get them to the services that they need.
Hi, my name is Arlette Flores. I'm the other social worker here at Southampton High School. And another issue and a concern that we're seeing is the access as well, not only the access, but also the bilingual, the bicultural access to psychiatric evaluations and more preventative education for parents and how to recognize the signs of drug use here in the high school level.
Also, one of the things that I would say in terms of that support, I don't want everyone to lose sight of the fact that with plans for Southampton Hospital to be relocating, one of the things in terms of access that can help is ensuring that we do have a CPAP type facility in that new hospital here in the East End. Trying to get our students up to Stony Brook, and again, some of the other places when East Quad can't go, it's really been, the access is a major problem. But trying to bring some of those services here, if we are looking at a redesign of that hospital, is something that I believe this town should be advocating for.
May I just interject and ask what the CPAP facility is?
Sure, that's the, Kim, do you want to answer that, or would you like me to? Why don't you go ahead, Kim, and the child psychiatric? Yep.
It's located in the Stony Brook Hospital out in Stony Brook. It's for mental health crisis. So if we have a student that is in crisis with suicidal ideation, or even sometimes on substances, specifically in school that we can't identify, we have to send them to the hospital. And as far as the suicidal assessments, CPEP is, it's psychiatric evaluation. Dr. Garson, you can correct me if I'm wrong or add something to that, because I know you know.
Okay, CPEP is for comprehensive emergency psychiatric evaluation, and it's a rough place to go to. Not only do you have the little kids, medium-sized kids, and big kids, you got people who are overtly psychotic, delusional, and it's a very good program for general mental health quick evaluations, but it's definitely not an access for kids who need to be number one, they have to be transported all the way there, and if they're being transported by the police, they have to be in handcuffs, which is an arcane situation, but that's the way it is. So CPEP is one aspect. There is another program that Family Service League opened up, and that's called the East End Mental Health and Substance Care program at Riverhead. And that's fairly good. And that's open 6 to 7 days a week, 12 hours a day. And that's like CPEP light. DASH, on the other hand, is even further out in Patchogue, but they are less intense than CPEP. And that's those issues.
And again, access is a major piece,
yes,
for even the Quinnipiac piece, that having to go to Riverhead for the initial start and screenings, then to come back here is just very preventative for our kids. So if we can even streamline that process, that would be very, very helpful.
Mm-hmm.
Thank you.
Thank you.
Thank you very much, everybody. I think Mark is going to go over what some of our recommendations are, and then we'd be happy to answer whatever questions you have.
And first of all, I just want to thank the town board for having us here and listening to us. And then just wanted to touch base on a CPAP transport. And Dr. Carson had talked about a child having to be handcuffed. That's also takes 2 police officers off the street because it's a 2 police officer transport. So when you're looking at town resources and you're thinking about coverage throughout the town from a safety standpoint, 2 police officers transporting to Stony Brook, basically you're looking at 3 or 4 plus hours that 2 police officers are off the road. So it's something that you should definitely consider. And, you know, we come up with a few recommendations to talk about this, and part of it is improving coordination, reducing fragmentation. And we have a mental health committee, an addiction committee, looking at the merger of the 2, a coordinated effort between it, a lot of good people, a lot of volunteers, a lot of knowledge, a lot of resources and stuff. But we'd also like the town to consider right now on a part-time basis, a professional that can actually be helping the coordination of individuals that are looking for, don't know what to do. I get calls all the time from people about my child, my spouse, my employee. There's a resource that's available in the town. Eventually, we'd like to see something coordinated for the entire East End. But if we just focus on our 150 square miles in the town of Southampton with a part-time person initially, I think it's a good step. We want to look at reducing the stigma campaign and trying to normalize treatment, not only for substance abuse, but also for the mental health piece. We did a nice job when it came to opioid education, putting together some flyers, a lot of resources that are available, putting up on the using Suffolk County Community as a solution helped us out. We also put handouts for the police department and the ambulance and any type of situation they have the ability to hand something out to family members who are around, or even the individual, on how to seek help. But we'd like to expand that. So looking at, again, aggressive community education, like the handouts with first responders and school personnel and, healthcare community. We got those handouts in the hospital, try to get them out to religious organizations, mental health, first aid training for youth and children. And you see it, first aid, they're doing first aid training in the high school, just some basic education for kids on how to identify the signs and symptoms of someone who's abusing substances or maybe having mental health issues and stuff. Some simple stuff that people can use, and even getting down to maybe some de-escalation training for students, I think is important. So how do you handle yourself in certain situations when you're faced with somebody who's having a anxiety, mental health breakdown, or under the influence? What do you do? And then, focus on visible information in places in grocery stores, et cetera. So, convene service providers and learn best ways to support and expand their services outside of direct grants. Develop a service to connect residents with providers is a long-term stuff, and then find collaborative solutions to address the service gaps, such as emergency psychiatric needs of adults and development of peer support groups. I think that as the demands on our system are going to be significant, especially as things have started to open up, emerging from their homes. I think there'll be less work at home, back in office settings. The court systems are all starting to open up. The caseloads are significant, the backlog, and the demands on our system. So any support you can give to what we're trying to achieve here, not only in the substance abuse area, but also in the mental health, because it's one, and so I appreciate your time this morning. And Nancy, I'm going to turn it back over to you. Thanks.
Well, I think, just so you know, the recommendations that Mark just went through, I'm sorry, were also emailed to you this morning. But really now we'd just like to hear your questions.
Well,
Nancy, if I could just real quick also add that workforce housing is also a major issue for our field, as most of us are not-for-profit. So securing workforce and having good places for them to live in our community is certainly a part of the conversation. My apologies for interrupting.
no, and thank you, Kim, and thank you all. Thank you, Nancy, to all the participants today. Mental health is such an important issue. I mean, typically towns, there's a lot of functions that a town provides. We don't have a health department. It's not considered the core of what a town does in terms of addressing mental health type of issues. But we have tried in Southampton to really address these issues, particularly through the yearly grant that we provide, that $25,000 grant, and our participation in the consortium. And we have social workers, youth workers, and we have programs that we try to provide. It is challenging, and certainly the pandemic has been a particularly challenging time, isolation and fear. And we had seen opioid deaths. We were encouraged by the numbers going down, then they went back up, not as high as they had been. So there's a couple things I want to hit on and then sort of ask you questions about. So certainly to, some of the things that you guys are asking for, there are dollars attached to it. So, if you want a resource officer, somebody who's going to coordinate, there's money involved with that, or a public education campaign, there is money involved with that. So if we had additional money, that's a positive thing. It seems that you guys are all concerned about the escalating use of marijuana, which seems to be out there. The kids are getting it now. If it were legal, there would be potentially $1 million or more dollars available for mental health issues that were taxed. It wouldn't necessarily increase the use. I'm not sure. I've read a number of studies, and you guys, I want you to give me the studies that you have that say that opioid deaths in the states that have legalized recreational marijuana have actually decreased, not increased. So I need to better understand that issue, because what you're saying to me is very different than that. So, if it's going to be available at the Shinnecock Reservation, it's going to be available in other communities, and we will not have the tax revenues that, I think that the board would be willing to dedicate toward mental health related issues. The other thing I wanted to throw out there too is, marijuana isn't the only concern out there. There's lots of other mental health impacts. Kim mentioned affordable housing and the sort of just the stresses of the high cost of living in our area and the lack of resources that we have. But there continues to be bullying. There continues to be social media pressures that these kids, unbelievable the amount of social media pressure and how it can really just surround a kid suddenly with negativity. And, you see the way these kids are constantly trying to live these sort of artificial lives, constantly posting and trying to compete and taking risks, because if they do something really stupid and crazy, they get more attention and more hits on social media. So, marijuana is maybe a piece of this, but there's also alcohol consumption, rampant. There is risky behaviors that are rampant. There is depression and teen suicide that I'm really concerned about. So there is so many mental health issues. And I do agree that we need better resources. I'd love to see a CPAP type of unit at Stony Brook, Southampton. I know it's been talked about in the past. But to do that's kind of psychiatric services on a small scale is very difficult economically. But if there was a way to do something small and calming here before transferring maybe to Stony Brook, would be a positive thing. So I've said a lot. I kind of want to get some responses on both the marijuana issue and also on the general mental health issues and how better to address them. So anybody who wants to start by answering those questions.
Well, I think today we really, although definitely we increased access and availability of marijuana. We know for a fact that it does, it imposes dangers for certain populations, not for everybody, but for certain populations in our township. And one is youth. For instance, there is a lot of data out there that show that young people, there is a documented increased use of marijuana among young people in states that have legalized recreational marijuana. So we know that there's going to be certain risks out there. So I think it is up to us to make sure we plan for those and we understand them. Youth aren't the only population at risk. Folks in recovery, it does increase the risk for those. People with certain mental health problems, greater exposure and availability to marijuana, it has an impact on them. And of course, pregnant and breastfeeding women, people with certain health problems. We know we want to make sure that we're thinking about how we protect those folks as we move ahead. I mean, you're right, marijuana is now legal in New York State as a recreational tool, and it's going to be around us. It has been around us, but certainly can't argue with that, as well as alcohol and bullying and all these other things. So, part of me is just like, let's not stir this pot anymore. We've already stirred it enough. We've got enough going on. But I think those are the things to consider.
That gets to the question of, like, not that it's going away. It's not going away. It's still going to be illegal for somebody under 21 to use marijuana.
It is.
Yes. But they're getting it now. So the question then becomes if use isn't going to decrease by opting out of the sale, but we won't have the revenue to address it, and there'll be this black market, and we won't know what the kids are actually getting because it's unregulated, and where the criminal element is going to be more profitable. What have we actually achieved? Because I don't mind taking the principled position that they should not be engaging in these drugs, but but they're doing it anyway, and we're not getting the resources we have to maybe move them in a different direction, or address some of the economic issues that are sort of underpinning this, that Kim sort of mentioned, or provide more social workers, more youth counselors, more psychiatric, direct psychiatric evaluations. We need money for all those things. And this could actually provide that. So that's sort of what I'm wrestling with is, are we opting out only of the revenues and not opting out of the use?
If I could just also add to that discussion from the school's perspective and some of the things that we've seen over the past couple of years, what we've tried to do is we've taken a very different approach. And some of you have seen some of the work that we've done, even going to Congress on the vaping issues. We have seen that a discipline-based approach to trying to solve this problem of whether it's marijuana use, vaping use, substance abuse, that is not actually in some cases made the situation worse, because by discipline-based approaches, we've seen that not only are we taking kids out of school, but then we know that kids are home now, unsupervised, engaging in the same behavior, and they're falling further behind in school. We've taken major shifts here and really focused on more on education campaigns and providing support resources with counselors and education on if you are going to make the choice, here's what you need to know, here's what we can do to help you, here's everything. So we've been also, if we find that students are engaged at a young age with use, rather than sending them out of school, we're keeping them in school and providing intensive therapeutic interventions. And we've taken that approach over the past couple of years, starting really with the vaping issue, and carried that philosophy through. And that's where I think one of the things that we have to consider, how can we provide schools and with our young people with intensive education campaigns and therapeutic supports. That's the approach that we have to do. So I understand, Jay, some of the challenges there, because certainly our approach is we don't want to fall back onto a quote unquote war on drugs type of mentality, because we saw the devastation that it does to some of our young people and particularly some of our communities of color. And we've seen a much more effective approach to keeping kids in school, continuing education and providing them as much education and therapeutic support as possible in schools. So whatever the town can do to help us achieve that goal, that's the angle that I really believe would be the most impactful.
More activities, more things for them to do. When they get bored, that seems to be when they start smoking marijuana. So if we kind of can have more fun things for young people to do, you know, it is a tough place to be young, and you're, you know, surrounded by opulence, and, you know, a lot of these kids are, you know, growing up in a basement somewhere, and, you know, the kids they go to school with are getting dropped off in Maseratis, and, you know, it's tough. You know, it's a tough place to be young, but if we can provide them with, you know, I think a lot of like vocational type of education really helps, like working with your hands. You know, I think it's a good release. It's a skill base. You're learning, you know, a trade that you can make extra money with, those kinds of things, more cultural things, concerts, whatever it might be, activities, you know, healthy activities. That would
Definitely, definitely, you're right about trade education. We really do need resources in this community for that young adult group who have finished high school and are, you know, really need some help finding their direction for their adult life, and, you know, employment training in trades that are, you know, provide opportunities for careers here on the East End would be a terrific addition to our resources. But, you know, I want to keep looking at the bigger picture today beyond marijuana too, because that is definitely a factor. And I think there's some important decisions to be made on that front regarding locations and densities and, you know, restrictions and things like that. But I think that, you know, the larger picture here too is that our resources to address any substance use or mental health issue is diminishing faster than we can stop it, when we can put our fingers in the dike, and our need, you know, the need on the part of the community is increasing. And as a community, we need to come together with a realistic picture of how can we help schools serve kids in schools better, and how can we help adults who are in trouble realize that, number one, they can be helped, and number two, that there are some resources that we can direct them to if we have a mechanism to do that. You know, some of the other things that Mark discussed in the recommendations, it's, you know, finding ways to help this community be more open to receiving the help that will address some of these issues and move us to a healthier place.
If I could just say, we started at the very beginning talking about COVID, right? And we can all agree that COVID is a public health concern for our communities. Addiction is very much along the same lines. And unfortunately, we think of addiction as moral failure as the individual. But I want you to get really clear that this is public health. It is me, the individual. The agent, right, is not bacteria. The agent is the substance, whether that's alcohol, tobacco, marijuana, opiates, right? But it's also the environment it gets to all grow and explode in. And I'm going to tell you, the East End, for multiple reasons that have been studied, tried, and true, the environment in which addiction grows in our communities is significant because of money, because of access, because of community norms, because of parental attitudes and behaviors. When I travel the country and you look at the numbers, whether it's from the Youth Bureau study or whether it's from studies that we've done with New York State of our youth, when we share the number of parents that say, yep, cool to drink in my house, rather you drink in my house, it's kind of a fallout of the DWI laws, right? We got really smart about DWI laws, but then we just felt that we would make it safe by letting young people drink in our houses in very fully stocked bars, might I add. This all becomes part of the conversation. And so if we could maybe not look at addiction as a moral failing, but really as what it exactly is a public health and public safety, and begin to talk about how we clean up that environment. And one of the things we know is when we're up against disease, when we clean up the environment, we don't add more things into the environment that make it unhealthy. And so it's a big picture to look at. And I appreciate your time in just listening and thinking about it that way if you do.
I have a couple questions. First, Mayor, this one's for you. I too dabbled in substances in my younger years. However, I was one of the lucky ones. I didn't have that addictive gene in me. So you had talked about an 11% number, and that's people with substance abuse or mental health problems. Does that include the people, or is it a separate number of those people who have that in them? Because several of my family members did. They are no longer with us for that reason. Is there a separate number, or is that 11% the percent of the population that really has an issue with all
That's
sorts
11.
of things?
That's 11%. It's yeah.
Okay. So the other 89% of us may not be affected by any of this, and you can do what you want and stop tomorrow, but that 11% is going to have continuing problems unless they get some sort of treatment.
What I'm going to say, I'm going to answer this question this way. But everybody's life has been adversely impacted by someone else's alcohol or drug use. So you might be in the 89% where you personally don't have an issue, but your life has been impacted.
Absolutely.
Period. So it's everybody.
And kind of a general question. So, and I don't know if anybody here can answer it. So there's lots of COVID funding going around. Can we use, or is there any COVID funding available for these mental health and substance abuse issues? Because in my opinion, although we're getting to the end of the pandemic, I think somebody said earlier, these issues that were complicated by COVID, the mental health and the substance abuse, are going to be, in my opinion, long lasting.
I mean, I could speak to currently you have Project Hope, which helps, and it may not necessarily, the folks who are trained into the position, they may not necessarily have worked in the field for a long time. So that is something definitely current. We anticipate some block grant funding coming down, both from the Trump administration and then from the new Biden-Harris administration. However, there's no guarantees that money coming down is going to go directly into Southampton town through New York State OASIS or OMH. We hope that we will be included in some of that, but there are no guarantees because I hate to tell you, the state thinks you are all loaded and have no issues out here. Oh, did I say that out loud?
So, and just thank you, Kim. And last thing, I just wanted to thank everybody for coming today. I have so many more questions, but probably not appropriate for this, but so I may be reaching out to you individually. And thank you for your time and all the information.
Julie, I would just add into that for mental health problems, the number, the percentage of the population that normally is, suffering from a treatable mental health problem is probably double the addiction. It's closer to 20 or 25%. We just don't have the capacity right now to serve those people. So we have two problems. One is we don't have the capacity to serve them. And the other is we also need to help them understand that they can be treated, that these are treatable problems, and that doesn't mean that there's something really wrong with them, that a lot of people in fact, the majority of Americans will be affected by some kind of mental health problem at some point in their life. Treatment is available. The earlier we treat it, the much better rates of success.
And 90% of anybody who has addiction, this goes, I always share this in hand with Mark's information. 90% of anybody who has an addiction began using in their teen years, when that young developing brain is so vulnerable and is in the largest time of growth in its life. So delaying the onset of youth is paramount in this conversation.
Absolutely. So anyway, we hope that we've given you some things to think about and talk about in terms of what the needs are, and what are the things that can be done within the town structure to start to help address that. Obviously, there's a lot more that needs to be done than what we would be thinking was appropriate for the town to do. But there are some ways I think that we can have an impact with, bringing people together in a constructive way, and providing the structure or the impetus for some really good community education, being a lot more aggressive than we've been able to so far on the education front and awareness front. And so that's, I think, the message that we would like you to take away from this. So
Nancy?
I don't know if yes.
Yeah, if I could, a couple of questions here. It sounds like you were wrapping up. I would love to get any information or any studies from folks on the presentation that connects either mental health issues or substance abuse issues to the legalization of cannabis in the areas of the country where that has happened. I know these studies exist, but if there are certainly some ones that you would like us to look at, please send them our way. I'll read them. And I just want to, as a former 32-year teacher, I've seen the effects of substance abuse on our young people. And I want to thank Kim and Arlette for the work that you do. And as a teacher, I always appreciated the social workers. So thank you. And Superintendent Zahn, thank you for providing those services to your educators. Very often we're the first ones to see some of the warning signs and some of the issues. And it's good to get young people their help. So if there are these studies, we are going to be making a decision on this in the coming weeks. Please send them over. So thank you.
Other board members, John or Rick, you guys have any questions?
Yeah, I would like to ask Kim and Alette, what is the process if a child comes to you in school and they've been bullied and they have suicidal thoughts? Where do you go locally, and do you eventually refer them to a county service, or how does that work?
Well, Mr. Martell, it's actually a tricky question because it really depends on the situation itself. If we have a student who comes in with suicidal ideation, typically we'll do a brief assessment to see how severe the situation is. If it's a moderate, we will sometimes have our resource officers, Officer Tiffany and Officer Lisa, excuse me, transport them to CPEP or to a hospital directly after calling the parent. If it's like a low risk factor, we can call Family Service League and we will get them an appointment as soon as possible. Typically, they'll try to get them in that day. Their parent will have to come and pick them up, so they would have to leave work and get them, and then bring them to East Hampton for an assessment in that situation. That's pretty much.
In addition to all of that outside referrals, we here at the school, do our interventions, continue to follow up with our students, even mediate with some of our students who are having some sort of issue with each other, and try to make the school climate as peaceful and as safe as possible for all our students to thrive here.
Great, thank you.
John, do you have any questions?
And just to add one more piece to that, if it is after school hours, we also have the ability for our social workers who do work and direct parents to the DASH hotlines and other places, because many times we do get, and Kim and Arlette are receiving messages from kids after hours. So it's not even just during the school day. We're trying to meet the needs over weekends, over holidays, in the evenings, a lot of times when things happen with kids.
Yeah, I wanted to make just a couple of comments. This is a huge issue with so many moving parts. And, you have the ability to do things in a practical sense. The other is trying to find money and resources to do this, to make this happen. We've got a lot of different groups around, Southampton Hospital, in a way, I think is a resource that I personally would like to concentrate on, having for the last couple of months gone through and sort of watched how, to someone's point that they made, how people who have insurance have resources, they have help that's available to them, and people who don't. And it's a very stark reminder when you see that, how people in certain communities are completely without aid, help, or support in any way, because quite often they don't have the insurance to do that. There are a lot of resources. I've watched some really special social workers who are there. They do the job, but I just know I grimace when I realize how many people are not being served by those very same services, and how can we find money to make that field equal? And I think that's a lot of what I come away with from this. Where are the resources that we may derive from the federal government to help offset some of the issues that we've had with pandemic-related, COVID-related problems that we're going to get paid for or reimbursed for? How do we do that? I was thinking, even with infrastructure money, I mean, in a lot of ways we are infrastructure, and I see all these efforts, and you great people that are there, you're doing an awful lot of good work. I'm just wondering how it's all organized, how you are organized together. You're more powerful together. It's a larger, bigger voice. You've given me a lot to think about, particularly with the hospital. There's a lot of resource there, from money for the Phelps Center and cancer centers and all the money that's gone into Southampton Hospital. And they do a fantastic job as far as the leadership kind of thing. What kind of influence can we as elected officials have on other government levels to help make that happen? I'm thinking about the new hospital. I'm thinking right now, when I'm done here, I want to give Assemblyman Thiel a call and say, what's the deal here? What can we do? What can we do to help? And so anyway, I just want to thank you all very much. It's one of those problems that's it's not really a train. It's more like a tsunami, and no matter what you do, it passes you by. You can't. There's so much involved. You take the aerial view to try to fix this, and it's a big one. But I like to get down into the nitty gritty and to practical solutions. What practical solutions can we provide? Can our youth services or senior services help provide transportation if that's an issue? And if we could drill down on what those kinds of issues are, what can we do as a government, that we have services in place that we can divert to a particular cause when it's needed, those kinds of things. So there's a lot for me to think about it in those terms of what we actually have in hand, and then hopefully reach out to get money to fund other things. And some of the work you're doing it's thankless, I think, in a lot of ways. We've all seen this. We've all gone to school. We've seen some of our schoolmates disappear. We've seen the effects, as I think Mark said, it affects everybody in one form or another. So I'm thinking a lot. Now I'm thinking out loud, so I better stop.
Well, good. Thinking is good.
I just wanted to answer the supervisor when you're talking about the revenue generated by marijuana, and I think you have to look at the long-term impact of that. And really what we're asking for is that We're not asking the town to put a lot of money into this. Okay, we're really looking for consolidation of efforts between mental health and addiction committees. And then we're looking for educational opportunities here. And we've done some stuff. And then we're really looking for someone on a part-time basis to help kind of coordinate all of these efforts throughout the town. And so we're not looking for CPAP programs and transportation all over the place. And there's a lot of other funding sources and private and not-for-profit organizations out here working with the hospital system and all of their resources. Really, that we're asking the town just that simple stuff. So don't try to make a decision on a tax base around marijuana use and say we need all of this to pay for all of these efforts of the town because the committee's asking for so much from the town. We're asking for a part-time.
I hear you, and I don't want this. I certainly wouldn't want this decision to be a financial decision. It's health is first.
Yeah.
So I think it's really important that we look at the data, though. I like to make data-driven decisions. And if you're actually not achieving your health goals by the decision and depriving yourself of the revenues to address some of this situation that's already going to be happening, that's something the board's going to have to wrestle with. So I realize that your ask is not that much in terms of dollars, but some of the larger economic issues, whether it's providing more activities for children or addressing some of the income related issues, we would need significant resources to try to improve the opportunities for people.
Yeah.
So it really, there's a whole spectrum of things you can do if you have dollars to do them, from building sidewalks to daycare centers, to parks, to, playing fields, to all kinds of things. You were a mayor.
I know.
Too, and
if it was easy, everybody'd be doing it. So,
well, it's important, like, we really understand what is going on. That's why I wanted to bring up the other issues of use, not just the drug issues, because the bullying issue, that's a real issue. The social media issues are, the wealth disparity issues. It's tough, on these kids feeling like they can never have those things, so people need a reason to live. They need to look forward to the future. They need to see a bright future. And when they look ahead and they don't like the path, they don't like what they see, they start engaging in risky behaviors. And we see it over and over again. And so there's a lot, we have to approach this in a multifaceted way. And I sort of always default to like building community, right? So we did this with the opioid thing. We wanted people to know that we cared about them. We didn't want to see them die. We felt that they had something to give and to contribute, that there were resources out there for them, that they were part of something bigger than themselves. And I know, Mark, you're very familiar with this, and with programs like AA, and part of it is, understanding that you're part of something much bigger than yourself, and that your future is promising. And I think that all these things sort of have to come together. And some of it is financial. Some of it is just having a supportive, loving community, and connecting people to the resources that are already existing. And, I mentioned with the schools, the trades. I really think that the schools, and we have Brian on the phone, on the call, if we're just preparing them for jobs that don't exist in the community, that they're eventually going to have to leave the area and go to some place that's unknown. And whereas there's so many jobs here where they can make really good living, and these kids are really skilled with their hands. And I know for me, when I was going through a tough time when I was younger, soon as I started banging nails and, building decks and working with my hands, things started to come together for me. It was really part of a healing process. And, I see out here the cabinet makers make more than the doctors, and, and the plumbers and the electricians and the trades. And, I just feel like we could do more with getting these kids there. The academics are important, and all the state requirements and national requirements and core curriculums and things like that. But when they learn how to fix a motor or does like something tangible or, or tile a bathroom shower, there's something immediately rewarding about that, where they can see what they've done. It's tangible, it's real. And so I'm a big fan of like increased vocational education and not segmenting it or taking it out to some BOCES building somewhere, like bringing it in and respecting those trades, not as a lesser career, but as a really great way to make a living. And
so I really agree with that. Nancy, one suggestion I would make, our anti-bias task force is going to be making a presentation to the board at a work session about housing in particular. And I don't know if this is a subject that's actually come up in their discussions about housing and the impacts it has, how it directly impacts the efforts that you are all talking about. I would suggest that you maybe reach out to Thelma or to Jim Banks and maybe inform their presentation about that. I think there's such a direct relationship with that. Also with our affirmative action task force, particularly we try to reach out to teach people, young people, how to take the civil service exams and parks jobs and those types of things that, you never know if you don't explore a path what you might find at the end of that path that can lead us to help find young people work that's meaningful and helpful, as the supervisor describes, and sets a person on a different path. And quite often just being surrounded by people that are not in that same boat are very influential to young people. It was my experience as a young man in school that, if you surrounded yourself with people who use drugs, you would end up using drugs yourself. And I think that's part of it, is providing an avenue for that kind of, a vision to see what's possible and not just seeing nothing in front of you that leads to that kind of despair and depression.
To be able to have a pathway that stays in the community, a community that by being able to have a trade that you can actually work locally at. And if we are able to provide some starter type apartments for people to, affordably priced rentals, then they begin to see a future that they can understand, that has less unknowns. I think it's really important, and they could be very successful.
Absolutely. I agree completely that I think that young people need to feel, number one, that they can support themselves in a comfortable way in their own community, that they have the skills that they need to earn that living and that they see a future for themselves. I think that we do have a good population of young people who sort of finish high school and have no plan. And it would be great to be able to give them some of the tools that they need to make a future plan for themselves.
If there's that disconnect where they see the adults in their life telling them all the things that they have to know, that they don't think they need to know, they think it's useless information, you're making me learn calculus, whatever it is, and I don't need that to survive, then they start to not trust us and not believe in us. And, they question the things that we tell them and whether we're right or not. And I think it's really, and I know Brian gets this, but it's really important, I think, that we develop that relationship of trust and that we're providing them with a future that is tangible to them, that makes sense to them.
Yeah, and Mr. Supervisor, just to validate that with a very small sample size here, we did bring back and restore a vocational program, a carpentry program here. Within the 3 years that we've had it here, the enrollment in the program is booming. We've managed to save a lot of kids that would have been potential, we would have lost through high school dropouts. We've had kids with substance abuse issues, mental health issues in the program that have kept kids in school because of offering that. And this program provides students with the ability to exit the program with a direct path into the carpentry union, local union. We're looking to expand upon the local vocational offerings with surrounding schools here, because we believe that's a critical piece to this puzzle as well. So with the small sample, and just from us, very small sample that we have, it's had a very big impact, and it's been a very valuable program to helping kids stay on track, and also making sure that they are finding a commitment to something else rather than leaving school and being involved in substances or other could be other mental health issues. So there is a lot of truth to that. So thank you for sharing that, Jay, and we can validate that.
Most of our economy, most of our local jobs have to do with real estate on one level or another. And I've asked this question to classes, like how many of your parents, their work has something to do with houses, either selling houses or maintaining houses. And it's almost every hand. Yeah, there's school teachers and there's nurses and there's, politicians like myself, I guess. But mostly it's second homes, taking care of home or year-round homes. That's what most of the jobs are out here. Now, so yeah, we really need to be preparing them for those types of jobs in a more significant way than we have. And Brian, it's great to hear that you're doing that, and that program is really helping those kids. And some of their parents are master craftsmen, and we have masons out here that are among the best in the world. We have landscape designers and gardeners, and the skill base is extraordinary, and some of them make really great livings doing it. They have their own companies, and so learning how to balance a checkbook is I think really an important type of skill. And all those things that relate to running a small business, I think, is really important too. But it really gets back to addressing the big picture, right? It's that big picture of mental health, and not, we want them to make healthy choices and not go to these gateway drugs and not start down a path. And when they do go down that path, we want to try to bring them back. But I think it's really, it's that bigger picture approach, to strengthening, community, what I consider community, a place where, everybody belongs and everybody is nurtured. And, how do you do that? And yeah, and some of it does take financial resources to provide the activities and opportunities for people. So anyone else before?
I'd like to. Sure, I'd like to chime in here on our New York State curriculum, and I fully support increasing vocational skills, and I'm familiar with Southampton's program. It's a successful program, and it's certainly worthwhile, especially for those students who avail themselves to it. But I think it's important to note that New York State public schools, particularly here on Long Island, offer some of the best public education to kids in the world. And we are training our kids for a world economy, and we are in competition with other schools. So I wouldn't want programs like our second languages or calculus or some of the higher level courses that we offer our kids to be,
no, I agree with that too.
Shortchanged, for lack of a better word. Yeah. And, so as a former teacher and someone I've had plenty of students who question, like why they're learning what they're learning. And let's face it, a 16-year-old may not, get the full picture of a wide-ranging education that we offer them here. So I certainly would like to see, more vocational skills. I offer a program myself through my position here on town board, to get kids involved. And I think involving them in the community with positive adult role models is key. Yeah. And like I said earlier, I'm interested in see some of the studies, and I am looking around myself for our overall question here about whether or not to legalize cannabis or the sale of cannabis in
Yeah.
Southampton town.
Yeah, and Tommy John,
We have
don't
good
get me
schools.
wrong. I don't want to walk away from the academics either. I think it's a balance. I think everybody should be exposed to all of it. So they should have, shouldn't always be
Right.
cerebral. It shouldn't always be, intangible, just information, content. It's got to be working with your hands. It's got to be part of everyone, even that kid who's going to end up working for Google.
I was raised as a plumber. I understand, Jay.
Okay. Oh,
Yeah.
Exactly. All right. Well, I want to thank you all for the work you do and for really bringing mental health issues to the forefront here. It's so important for all the reasons we've discussed today. And, the town board will discuss as we do our budget, what resources, economic resources we are able to bring to the table to assist in this function. But certainly having all of you guys out there doing what you're doing is really important to the community. It looks like I see Drew's been quiet there too, but I see Drew on the call as well. So I want to thank Drew for participating. He was part of that vigil the other day as well. And so I think we're going to move to the next topic here, which is really just updates. And those who are here part of the mental health conversation, you don't have to stick around. First thing I will bring up is sort of connected to what we've been discussing in a way. We did a ribbon cutting. Connie was there for it. So was Rick Martell yesterday, Councilman Martell for Rise, a new food pantry out in the Hampton Bays community. To address food insecurity. And it connects with what I was saying too about the disparity between rich and poor and the high cost of living in our area. You have people who are working, a couple with, each with a full-time job, still finding not enough money to live in our area. It's really challenging. So the ability to be able to get healthy food out to people is so important. And the pandemic, as you know, has been really hard on economically on people. It still is on some. There's still some industries that haven't bounced back. So, so Rise, which is a group, they have a facility out in the Riverhead area. So this is their second on the East End, but they have facilities all over the place, just not on the East End. So they opened up a food pantry, and they had two guys, I'll forget their names, but they were with the 1969 Mets, Art and Ed. And I could pull up their names, but Cranepool.
Yeah, Art Champsky and Ed Cranepool.
And Ed Cranepool, thank you. They both played on the 1969 Mets when they won the pennant that year, and they were there. So we had two champions, two legends, and that was really nice. The guy Charles, I think, is the guy from Rise. He spoke, and there was a representative from Bridget Fleming's office. Irene Donahue spoke. It was a nice event. Also. Earlier that day, yesterday, Rick was there, and Julie and John and myself. I don't remember. Tommy John, were you at the police memorial? I don't recall. You're muted.
Right, and unfortunately, I could not make it. I had
So it was, this is something they do every year to remember police officers who died in the line of duty. We're always cognizant of the risks that police officers take in doing their job. And it has been a hard year, no doubt, for police officers with all the, the high level attention. from, you know, certain incidents that happened around the country. You know, we try to give our police all that, you know, the resources that they need to effectively do their job, and also, you know, to protect them physically from harm. It's interesting because this was a COVID year, you know, a once in a century pandemic, and law enforcement had to continue to do their job. They would have to respond to a domestic dispute, not knowing if they were going into an environment where you had this invisible threat of COVID. And yeah, police officers, too many died of COVID. Not in our department, but around the country. So it was a new risk that we don't often think about. You know, no bulletproof vest is gonna, you know, stop COVID from impacting your health. So, but it was a nice ceremony. It was really well orchestrated by the police chief and by Lieutenant Ralph. And I'm glad I went to that. I said a few words myself, and you know, really moving. And it sort of not only honors those who have fallen, but reminds us of the constant dangers, and you just never know what that next call will bring, you know. And I have great confidence in our police department and the bravery of all the individuals there, that they, you know, would put other people's lives in front of their own, to protect public safety. And, it's a calling. It's a massive commitment that these individuals take when they enter law enforcement and they put on that uniform. And we're certainly thankful to have them there. And, we pray that no harm comes to them, but we're certainly aware of the inherent risks that face our police officers. Let me think if there's anything else that I wanted to bring to your attention. Nothing is immediately coming to mind. So does anybody else have any updates?
I do.
Julie?
So our little food pantry at the Crohan Center in Flanders is up and running. It's being used significantly. So I'm just putting it out there. Anybody can donate to it. You can go right to the little food pantry box, which is in the parking lot of the Crohan Center, and put your items into the box, and people are using it. So thanks to everybody who are involved in it. We're also working to get another one on the Shinnecock Reservation, which I think is great as well. And I'll give you an update on that as soon as some details have been hashed out. On Tuesday, we launched our active military and veteran discount program, which is a partnership between the town and local businesses who decide to sign up, and our veterans and active military. Local businesses can offer a discount or a benefit on purchases and services, and the vets, as a way to be honored by us, the community and the businesses, get a small something out of it in recognition for their service to our country. So if there's any vets out there or businesses who'd like to sign up, please do so. As with anything, there's a couple glitches and we're trying to iron that out, but go online, call the clerk's office, call the town council office, or come in person and get your card, sign your business up, and thank our active military service members and our veterans.
All right, thank you, Julie. Anyone else?
Yes. In terms of our fire departments, we're to be announced at Southampton Fire Association a GIS overlay tool that they can use. This is something that I had brought up ago, and our department has been working a tool for our first responders, particularly for firefighters. And can you all hear me? I'm getting a little unstable message on my.
I had a
hard back. This is an overlay. Okay. We'll be announcing to the fire chiefs that our GIS firefighter level for our GIS is going to be opening up soon. It gives firefighters the ability to produce diameters as well as conical layouts for hazardous materials situations, as well as locations of fire hydrants and water mains in the area. This also is going to support our battery and solar program as well, something that firefighters need to be aware of. So something I wanted to bring to the board and thank our GIS, particularly Ross and Ryan Murphy, for working on this.
Great.
Right, thank you.
So a couple things, if I could, Jay. The pantry at the United Methodist Church for Rise, it serves a couple purposes. One is they use some developmentally challenged adults in the process of giving out, stocking the shelves and all that. The food comes directly, in most cases, from Long Island Cares and Long Island Harvest, which kind of connects the dots to our community so that the food can go directly to, you know, those that need it without having to search it out at the different pantries. You know, I think it was a wonderful presentation. I did enjoy meeting Art, and I've known Ed for quite a few years, so it was nice to see them again. We did get an update from Ryan Murphy that they are officially open, the new public safety offices on Ponquag. So the fire marshal, code, and animal are all in one place in Hampton Bays now, so you can find them there a lot easier than taking a long trek to Town Hall. And the last but not least, the Great East End cleanup. We had a tremendous amount of people over the weekend who signed up, who went out and picked up as much garbage as they could and found less than previous years. So kudos to all the other organizations who had run their cleanups prior to ours, and to our Parks and Rec department, who has done an outstanding job in our parks and beaches at this point.
That's great. That's great news. And thank you for mentioning code enforcement moving to Hampton Bays. And at some point we should all tour that facility. And there's a meeting room there too that can be used by the public or by town, you know, other town programs like town board. All right. Any other updates? All right. We have a couple executive session items. We've got acquisitions. We have confidential legal advice. I'm not sure about personnel matters. I don't have it on the agenda, but there may be personnel as well. So I will make a motion to end our work session and go into executive session on those items.
Second.
Seconded by Councilwoman Lofstad. All in favor?